I've reacted to YouTuber injuries before, but apparently there's a few I missed, so let's check those out and get started. Whoop. Got some football stuff. Oh, is this destroying? I heard something about this.
It's crazy how life could change.
Was that the injury? Was that when it happened? You know, leading head down is not the correct way to make a tackle from a safety perspective.
Instantly as I hit him, my whole left side of my body go numb.
Oh, no.
My arm is hurting.
Oh, no.
My neck is hurting. And a team doctor evaluated me and he said I'm all right for now. Let's put some Tiger Balm on it, finish off the game, and we'll do further tests afterwards. But I don't know if I'll be tackling people like that again.
Yeah, whenever you lead with the crown of your helmet, you essentially open up your neck to all sorts of injuries. That's why ideally you want to be tackling almost with the shoulder and being able to visualize the person you're making the tackle of.
So what happened to you?
On a kickoff, I went in and tackled somebody in proper form, head was down. And I mean, I guess I'm...
Do you have a video of it by any chance?
See, that's a great question by that physician because mechanism of injury is so important. In the video, you could see his neck snap backwards, signifying that there's a hyperextension injury. And hyperextension of the neck is very, very dangerous because not only are there some connective tissue parts like the ligaments in the area, then you also have in the back 2 arteries that run up on either side of the spine called vertebral arteries. And when you have hyperextension, especially to one side, you could actually sever those arteries. It's obviously not what's going on here. I'm just describing the dangers of a hyperextension injury.
What did you feel when you did it?
The left arm went numb. And my neck just instantly got stiff.
So if I touch you here and here, is that 100% equal?
Yeah.
Here?
Yeah.
This is a good evaluation from a neuro exam standpoint. You're not just checking muscular function, you're also checking sensation.
Is any of that super tender?
Towards the lower.
You've had a pretty significant injury to your neck. You fractured what's called the lamina, and you've broken them at C5. You've also disrupted, there's a ligament that's not on this model that runs up and down the front of your spine called the anterior longitudinal ligament.
That's a very severe injury. He essentially broke his neck. The neck is made up of 7 vertebral bodies, C1 to C7, and the higher up on the spinal cord that you have an injury, the more devastating it is. C5, depending on where that injury is, can impact your upper arm muscles. It can impact your ability to speak, like your vocal cords, and make it more difficult for you to breathe. And that's if the injuries of the spinal cord. Right now, all we know is that the injuries of the bone, and specifically, it's the posterior portion of the spine known as the lamina. If it was any other part of the spine, it's likely that he would have had more symptoms. But when you have the lamina fracture, that actually creates an opening for swelling to happen and actually can mitigate the symptoms. We actually perform what's known as a laminectomy, where we remove that part of the spine to allow less damage to occur for the spinal cord during other back injuries. So the fact that that part broke can allow a situation to happen where he's not sure that this is a devastating neck injury. That's why it's so dangerous.
So, I mean, it was a major bony and ligamentous injury, and you have 2 small disc herniations at C5-6 and C6-7.
Disc herniations happen as a result of major pressure on the discs. Those are like the little spongy areas in between the vertebrae. Depending on where it herniates, it can create different symptoms. So if it herniates inward, it can actually put pressure on the spinal cord itself, which could be devastating. If it goes outward or to the side, it could put pressure on the nerves that exit the spinal cord and have symptoms on only one side versus the other.
The reality of this is these will probably heal, but it's probably going to be 3 months in that collar for it to heal.
I don't need surgery, right?
No.
That's interesting that they're saying he doesn't need surgery. It must be a very limited fracture, because a lot of times in a situation where the C5 vertebrae are fractured, you do need fusion surgery to make sure that they're stable. So I don't know the extent of the damage here, but it clearly must be at a reasonable amount that they feel he can just allow the area to heal with the C collar on, protecting the spine, and then do some rehab work as well. You know, sending my best wishes to a speedy recovery to Destroying on this, because I can imagine how hard it is for being an athlete and having this happen to you.
By the way, this car that we've been standing next to this entire time, I bought this. The reason I had to buy a brand new car was because the next myth is that you can break a car window with your fist.
Oh no, don't do this. Not only is someone gonna get cut and gonna bleed a lot, someone's gonna break a bone in their hand. That's not even a myth. Like, you're not supposed to do this. Like, there's even specific hammers that people have inside their car to break out in case they're like trapped or they're sinking.
Here we go. Whoa! Oh.
People, be careful what you do for views, because this could become so dangerous. Like, cutting yourself in areas where you have major arteries is so scary because you could die in a minute or so.
Max getting stitches right now. That was a awful way to start the day. That was a stupid thing to do. That was a stupid bit, and creating entertaining content, we sometimes get carried away. That is a lesson learned on getting carried away right there.
Don't do that. You don't understand. Don't play with glass. Don't play with sharp objects. I can't tell you how easy it is for things to go wrong.
So it's freshman year. I wanted to do like an activity. What I tried to do was parkour. And it was like supposed to be a quote unquote beginner parkour thing.
I hate when things are say beginner because they're always still so hard. Like, I'll take a beginner yoga class and not walk the next 3 days. I just started using the tonal machine and I did a beginner class and it was so high intensity in terms of going from exercise to exercise. I got so sore, even though like I'm pretty strong. It's really funny.
It's time to drop from the second story and do a sweet tuck and roll into this little grass patch.
That sounds so scary for a beginner. Like, maybe you should just practice that on a mat first.
That I realized they assumed I knew how to do a tuck and roll, which I had never done in my life.
You should probably practice it before doing it off the second floor. Markiplier, come on, bud.
And so they're all giving me encouraging words. They're like, you can do it. And I'm like, I got this. And so I drop. And I landed from the second story straight onto my ass.
Oh my God, I feel for his coccyx already. Donut pillow incoming.
And, you know, at the time, I never connected the dots to me falling on my ass and possibly breaking something in my spine to this weird thing where I'd go to the gym and work my spine and I would be in horrible agony.
I mean, obviously it could be anything. My suspicion is there's some kind of herniation poking out a nerve that gets accentuated with either flexion or extension. Or it could be something completely different like SI joint pain or hip joint pain. Usually those are not as electric in nature. Also, there could be like piriformis issues going on, but that's more like wear and tear as opposed to like acute trauma.
So I'll explain what happened. So I'm supposed to be bent over. A guy jumps on my back, who is your stunt double, grabs my back and pulls me back really fast.
It's those hyperextension injuries. See, it's like the theme of the video.
So I get pulled back with 100-something pounds of force, and then I have to pull forward.
And pulling forward also stresses all of these anterior scalene muscles and the sternocleidomastoid muscles. So you can like tear something just doing that. It also reminds me of like a whiplash injury from a car accident when you get rear-ended.
The stunt coordinator did not teach me how to properly
brace for it.
Do that. So for some reason that pressure all went straight to like right in between my abs, and I felt something pop.
Oh, he got a hernia.
So I put my fingers down between my abs, and there is a lump.
Little separation.
There's a lump right here.
Yeah, if you increase intra-abdominal pressure with relaxed abdominal muscles, you can create a hernia. And a hernia is essentially your intestines, your abdominal contents poking out through the hole. When the abdominal contents are poking out, if you try pushing them in, you can't. That's called non-reducible, and that could be dangerous because that could lead to incarceration of the bowel where it's actually getting choked out, and that's a surgical emergency. Or if you can push it back in, that's called reducible. That's the more common type. You can go for an elective procedure because of the risk, the increased risk of having incarcerated bowel.
And I didn't know what to do, so I just
pushed it back in.
No.
Yeah.
Don't say you pushed it back in.
So I pushed it back in.
He reduced it.
It was right above the belly button area, right here. And sometimes if I like do a certain thing where I pull up like this enough, and my skin is like tight enough, you could kind of see a little bump right here.
In those cases, we ask a patient to bear down or cough or lift up their head so that it flexes the area, and sometimes increasing that intra-abdominal pressure can cause the hernia to pop out.
Immediately when the doctor saw me, they're like, yep, that's a hernia. And I was like, cool, so how do I get that fixed? And they're like, you don't. I was like, what do you mean you don't? And they're like, well, so the thing is, if we want to fix this, we're gonna have to do surgery, open your skin, push it back.
You could do this laparoscopically.
And they said that they only recommend doing that if you have like a full-blown hernia. My hernia was like a weird thing where it's like a few layers got weak and it like a little protrusion happened, but it wasn't a full rip open with a full intestine.
All right, so it's not a full hernia.
I was told that I should never lift weights again.
All right, there's some kind of like weird medical advice happening here with like a half answer. There is like a weakness in the abdominal wall called diastases recti. This actually happens during pregnancy sometimes when the abdominal muscles split, where you actually have a weakness in the wall and you could see protrusion on increased abdominal pressure. And we say be careful with abdominal exercises, but we don't say never lift weights at all. So I feel like we're kind of hearing both sides of the story, that it is a hernia, but it's not a hernia. It's probably diastases recti, which is a condition with weakness of the abdominal wall like this.
I'm guarding Michael Jordan. Bro gets me with a nice crossover, can't even lie. Boom!
Oh,
He
elbow.
goes up, hits me with a mean, vicious elbow to the chin.
Oh, that wasn't purposeful though.
Jesser fouled him. I'm pissed at this point because I'm dripping blood and there's a foul on me for getting elbowed in the face.
Well, yeah, it's depending on where you are on the court, if you got in the way of the shooter's arm.
I have to get subbed out. I go straight to the bathroom. Our team nurses rush in to the bathroom to help.
Does he have a chin laceration? That's gonna require sutures probably.
Close-up shot of the chin. Look at
Ooh, that's a solid opening that requires closure. And the reason why the chin and the skull have these really severe lacerations like that is because whenever you have contact from like a hard surface like someone's elbow, the skin gets trapped in between the hard elbow and your hard chin, and that essentially acts as the force that cuts it. So if this was like padded, like let's say the buttock is, less likely for a laceration to happen, more likely a bruise to happen.
So let's go through it, head to toe, total damage. I've had no shortage of concussions, and I figured that my brain's pretty messed up, so I went to this brain scan place.
Oh, no.
And they said it looked pretty good.
What that brain scan place is doing what's known as brain electrical activity mapping beam. That doesn't actually tell you anything about the anatomy of the brain.
I didn't see nearly the kinds of things I expected to see in your brain.
Cool.
I do see what might be a sort of stress response from long years of drinking.
A lot of this is correlational and not causative, so I would be careful about drawing conclusions from an EEG. If you're really looking for damage, looking at anatomy through a brain scan like a CT or an MRI is going to show you more information. And even then, clinically judging someone is way more valuable than anatomically, unless you're in an acute setting.
My vision just gets worse and worse, and I think it might be because all of the lemon juice and hot sauce I poured in my eyes.
Yeah, Steve-O. Why didn't we talk about this on the podcast?
I've got another pretty serious situation in my esophagus, which is called Barrett's esophagus.
This is a precancerous condition. We talked about this on the podcast. What happens is basically the cell types, due to long-term exposure of acid, usually from leaking from the stomach, change the type of cells inside the esophagus, which is a cancerous change. Obviously, that can be lethal if you let it go unchecked.
I have to get that monitored with endoscopies like every year or so.
This really depends person to person and how long we've established stability. Sometimes you can space that out.
If I got $1 for every time somebody asked me if I could have kids with all of the kicks to my nuts, I'm telling you, I'd have a bunch of dollars. So I went to the fertility clinic to get a sperm count before my vasectomy.
It all depends on the damage.
Look at that, dude. I'm going off. Whoa! I'm going off. I'm off to the operating room and I'll leave you with this. The body is not a temple. It's an amusement park. Ride it till the wheels fall off.
Oh no, Steve-O, don't say that. You're encouraging bad behavior. And I'm actually surprised that he has no testicular damage from all the kicks and stuff that he's taken, because it's a sensitive area.
What's up, everybody? My name is Scott.
Oh.
And I'm gonna tell you about how my 50 cal exploded and I almost bit the dust about 2 weeks ago.
Whoa, where those staples are is so incredibly scary for me. The jugular vein, the carotid, there's so much anatomy there that is like instant fatality. Oh my God, oh my God. What? Does this happen? I don't know anything about this.
This cap hit me right there.
But he had the safety goggles on? Thank God.
But it struck me in the face. It broke my orbital bone in 3 spots, here, here, and here. It also broke my nose.
And that's so dangerous given the fact that you could have orbital swelling, damage to the muscles that attach to the orbit. Therefore, you have difficulties with vision and ability to move the eye.
The other ear hit me right here in the throat. It proceeded to lacerate my jugular vein and then punctured a hole in my right lung.
How did he survive this?
I took my left thumb, wrapped it in my shirt, and I shoved it as far into my neck as possible. The doctors told me that if it wasn't for this thumb, that I would have died. This thumb saved my life, and my wife came up with this saying. She said, just put a thumb in it.
Wow. And what happened? Why did the gun do that?
Complicated gun mechanic stuff.
But he's probably taking care of them, so...
50 cal is a really, really complicated piece of equipment.
Here's what's legally allowed to be in your food. This list will surprise you. Click here to check that out, and as always, stay happy and healthy.